If you're a nutritionist or herbalist, what can your client's eyes tell you about their bone health? Bone health, or more correctly, bone weakness, is something that we don't usually pay too much attention to until it's too late. That classic picture we have in our mind's eye of the stooped over little old lady that the Boy Scouts help across the street as being the osteoporotic woman is only partially true. The fact of the matter is, if you're over the age of 50, you are likely in the early stages of osteoporosis, regardless of what your gender is. 1 out of 2 women over the age of 50 and 1 out of 4 men over the age of 50 will suffer a bone break of some description because of thinning bones. I want to take a little side trip here, because being stooped over, like we see in this image, is not necessarily the only indicator that the person might be at risk for osteoporosis. As a matter of fact, this stooped over posture is often not really associated with osteoporosis at all. It is the result of years of bad posture hygiene. The sloppier the posture and the weaker the core muscles and the back muscles, the more likely we are to round over just from muscle weakness. And as the body is chronically in that kind of a posture, the bones begin to remodel to accommodate that posture. So if your clients don't want to end up all hunched over because of having worked at a desk job all their lives or some other thing, it would be wise for them to work with a personal trainer or a physiotherapist who can teach them how to strengthen their core and strengthen their back to maintain correct posture hygiene to stay upright. Let's get back to the bones. Bone health doesn't really start with calcium. It starts with digestion. If we have poor digestion, so low acid in the stomach, we can't break our foods down properly. And that means that we end up with improperly digested things getting into the small intestines. We get incompletely digested molecules getting into the bloodstream. That often causes an acid reaction at the blood level. Common symptoms of elevated blood acids are things like asthma, allergies, arthritis, skin issues, eczema, psoriasis, chronic sinus congestion, gout. All of these things tell us that the blood acid levels are out of balance, and that likely tracks back to poor digestion. Food choices can also decrease our stomach acid or compromise our stomach's ability to make acid. And again, if our stomach doesn't have the acid levels it needs, we're not going to get proper digestion of other foods. Dr. Christiane Northrup talks about coffee as being the single best way to pee your bones out 1 cup at a time. When we consider what coffee, black tea, and green tea do to the stomach lining and how they compromise the body's ability to secrete digestive acids, we've got a double whammy. Not only are coffee, black tea, and green tea reducing our ability to digest foods, they in and of themselves are increasing our blood acids, which then increases our calcium demand. There are other foods that also can lead to an increase in the blood acid. Things like refined sugars, red meat, dairy products, white flour, soft drinks, they all fight against us in this effort to balance our acids. Red meat should be eaten minimally, 2 or 3 ounces at a time, if at all. Let's talk about dairy products for just a minute. There is an amazing amount of calcium in dairy products. The problem is, when the calcium binds onto the milk protein casein, like so, the human body does not have a mechanism to split that apart. And we also don't have a mechanism to use the calcium when it's bound onto casein. So what that means is that the calcium that is in your dairy products gets bound up and goes straight through. It does not get assimilated by your body. It's interesting to note that the 4 countries that have the highest dairy consumption are also the 4 countries that have the highest rates of osteoporosis: Finland, USA, Sweden, and England. Excessive physical activity can also generate a lot of acid in the body, and we need to be able to counterbalance that with our diet, especially if we're really physically active. We'll talk about how to do that in just a moment. Negative emotions can also drive our blood acid up. Anger, bitterness, resentment, jealousy, frustration, fear, they all drive our acid levels up. By keeping our bodies more alkaline, what we do is we are able then to keep that blood acid level in check. When the blood acid level gets out of balance, the calcium's first job is to neutralize the acid. And so if that blood acid level is balanced, we aren't spending a lot of calcium neutralizing that acid. What are some of the things we can do with diet specifically to keep our acid levels in check and thereby protect our bones? Vegetables are generally more alkalizing than just about anything else you can eat. And I don't know if it's actually humanly possible to eat too many vegetables. Additionally, things like nuts and seeds, hemp hearts, and even whole grains to some extent are excellent sources of calcium. And this serves as a base if you should decide to use a calcium supplement. If you do decide to use a calcium supplement, you want to be careful to avoid a couple of things and to make sure you get a couple of things. Avoid calcium carbonate and dolomite. Calcium carbonate is also known as chalk, and dolomite is known as rock. Neither of those are really great for our bodies or for our bone density. They are not chelated in a way that our bodies can actually use. It's important to take your calcium supplements at the right time of day. So often on the bottles, the supplement will say to take it with a meal. Let's look at the chemistry again. I promise this isn't going to get too heavy. The stomach is an acid organ. Protein requires acid for digestion. Calcium and magnesium both neutralize acid. So if you've just had a meal that included protein and now you're going to put calcium and magnesium in with it, you are going to neutralize the acid that you require to digest the protein. Do you see the problem? Without adequate acid to digest protein, that protein sits in your stomach where it's warm and moist and dark. What's that protein doing in that environment? It's putrefying, it's rotting, it's creating noxious gases, and you're not going to get the benefit of having eaten that protein. So my recommendation is that calcium supplements should always be taken in the evening, just before you go to bed on a relatively empty stomach, or first thing in the morning when you get up, and wait about a half an hour to eat. Now, if you find that taking calcium on an empty stomach creates some nausea, take a little carbohydrate with it, because remember, carbohydrate needs alkaline to digest, correct? So if we put carbs in there, we're not going to create a digestion nightmare. So a slice of sprouted grain bread or a few whole grain crackers would do the job quite well. Should you decide to use a calcium supplement, you want to make sure that it has with it magnesium, D3, K2, boron, and silica. When we have all of those together, we get optimal assimilation, which means that it gets broken down, distributed, and deposited where it needs to go. Please join me on the 29th of November 2017 for a free webinar where we're going to look at iris markings that will tell us whether our clients are at a greater risk genetically for osteoporosis or not, or other bone issues. And we'll also look at iris markings that teach us about the skin and skin health. The registration links are in the description for this video.